Black magic. Is it the black magic of COVID, the black fungus, or is something else? I am Dr. Rajesh Mishra. You are watching Health Super Specialist, and let's start. So what is this black fungus? Black fungus is basically mucormycosis. Now what is mucormycosis? Mucormycosis is a type of fungus which infects our body whenever our body is in an immunocompromised state. Now, as we know, the COVID pandemic is going on, in which the rampant use of steroids is unavoidable to save the patients. So, everything in medicine is a double-edged sword. So, on one hand, we are saving the patient. On the other hand, due to the side effects of steroids, such as enormous hyperglycemia, severe immunosuppression, we are facing this problem of mucormycosis. Now, mucor basically belongs to the genera of mucorales, and other family members of this are Rhizopus, Rhizomucor, Epsiella, Kenunghamilla, Listhemia, and so on. The list goes very long. So, why the incidence of mucor increases in COVID? Now, this mucor, basically they have an enzyme called ketone reductase. Now, ketone reductase, what it does is, it helps the fungus to proliferate when the sugar levels in the body are high, which is very, very typical of COVID with a background of steroids, high dose steroids, which we are giving for the management. Now, what happens is, this fungus like mucor, it's basically spores are present in all over the environment, and it's our basic immunity which protects us from this fungal infection now and then. Every one of us inhale these spores, but our immunity makes us strong enough to fight against this fungal infection every time. Now, our COVID patients who have already been infested with a viral illness along with a superimposed immunosuppression by steroids is going to trap them in this trap of mucormycosis. Now, what are the other conditions in which we find mucor? Such as I told you, diabetes mellitus, most common. Immunosuppressed patients, especially blood cancer patients, solid organ transplant, lung transplant, liver transplant, renal transplant patients, patients who have got trauma, any trauma, patients who are burns, in cases of tornado, where lot of in Western countries when tornadoes used to come, the incidence of mucor increases, burns. In hospital setting, it's very, very common, and especially due to the use of intravascular catheters, due to the use of bandages, due to the use of hospital linens. This is pretty common in hospital setting also, as a result of which immunocompromised healthcare workers are at times being infected with mucormycosis. Now, is it a new disease? Is it an old disease? The disease has been documented since 1940. A study traced as back as 1940 till 2003. They had a case series of 929 patients, in which they found that the mortality is around 50 to 60%. In settings elsewhere, it goes as high as 70%. And a part of that, the common symptomatology of mucor in this study and further subsequent studies, what they found was fever was one of the most common symptoms. A part of that, periorbital swelling, the swelling in the periorbital regions. There is black eschar formation in the nares as well as in the hard palate. Hard palate, when you open your mouth, the upper part that you see is the hard palate. If you go inside, the upper part is the soft palate. So you can see black color. That is why it's called black fungus. So black eschar is there in the hard palate and the soft palate, and periorbital, facial swelling, fever, headache, and ophthalmoplegia, decreased vision. A person can be blind due to this mucor. One very special character of mucor is the angio-invasive nature. Now, what is this angio-invasive nature? By angio-invasive nature, we mean that it has a tendency to infiltrate in the blood vessels, due to which it causes this cerebral mucormycosis. That's why it's called rhino-orbital cerebral mucormycosis, ROCM. That's the short form that we commonly use in our setting, ROCM, rhino-orbital cerebral mucormycosis. And once it steps in the brain, the results are very, very catastrophic. So it's really dangerous, it's fatal. And so what do we do? What do we do in order to prevent this mucor? In a hospital setting, in an ICU setting, even in home setting, what we can do is we can take a good control of the blood sugars. We can just control the blood sugar with whatever drugs we are taking, with insulin, with whatever medication the patient is on. The patient can be given a gap for the immunosuppressant therapies. If the patient is receiving voriconazole, very, very important. Even in a lot of medicos, I have seen this, that people are rampantly using voriconazole. Now, use of voriconazole is really, really bad for mucor, because it increases the immunogenicity of mucor and it increases the mortality due to mucor. So very, very conscious with the use of voriconazole. So we can do that. Apart of that, we can be highly suspicious about such symptoms: facial swelling, periorbital swelling, headache, fever, black eschar in the nose, black eschar in the hard palate, in the soft palate. Now, how do we diagnose it? It's not as simple as given. So basically, there are three techniques. The first is the histopathology, the second is the culture, and the third is PCR based techniques. CT and MRI may be helpful in diagnosis. They, especially of the sinuses, they may show the soft tissue swelling. So that may be useful. A part of that, what do we see in the histopathology? Basically, they are non-septate hyphae, 5 to 15 micrometer in diameter. When we stain them with calcoflower white or methenamine silver, we see that there is 5 to 15 micron non-septate hyphae, and the budding is at right angle, budding is there. So it's very typical of mucormycosis. And regarding the treatment, the drug of choice is again liposomal amphotericin B. Amphotericin B, as we all know, comes in various formulations such as amphotericin B deoxycholate, liposomal amphotericin B colloidal complex ABCD, or amphotericin B lipid emulsion. So either of the formulations can be used. The drug of choice is liposomal amphotericin B. And a part of that, surgical debridement is very, very important for the treatment of mucormycosis, or the black fungus as commonly told in media nowadays. And a part of that, remaining are the preventive therapies, whatever we can do for the primordial level. And a part of that, the step down therapy consists of two antifungals again, isavuconazole and posaconazole. So that's it for the day. Thank you very much.